on the chat. So if there's anything, and so okay, students, welcome to the second lecture. I'm extremely pleased to be here today again. So I would like, and something I forgot on my previous lecture, is really to thank Debbie for everything she's been doing so far, and she's been of a great help. And I'm sure you're going to appreciate how much effort she's put into that. So if I were live, I would ask you to applaud her, but because we're not live, so make sure that you do that behind your screen. And so thank you very much, Debbie. And I'm so privileged because I'm going to ask Debbie, a doctor, to set some point question for me. So I feel very privileged. Anyway, so today, as you will see, we'll talk about one very important aspect, and we'll try to provide the key concept. I don't want you to go to the nitty gritty details, but more importantly, to look at what is actually very important. And I will try to make it as simple as possible with the feedback I had from previous students. Very important to receive your feedback as well, constructive feedback. So we're going to talk about the adaptive immune response, and you're going to see how fantastic the adaptive immune response is in clearing any type of infection. More importantly, you're going to learn about the different lessons we've learned from it. However, we're going to learn about love as well. What did you expect? You expect that immunity is just about cells, is about infectious disease, sepsis. No, it's also about love. And you're going to learn today that immunology and the immune system play a very important role in a number of different things, which is when it comes to love, when it comes to romance. So I would like to, Debbie, would you mind asking a question to the student? I would like to ask you, yes, who is in love? So you have 4 potential answers. Yes, I'm in love. No, working on it, and the last bit is not interested. So I'm just curious to see.
What's the first answer?
Sorry?
What was the first choice, Yassine? Yes.
Yes. Yes. I'm in love. No.
No. Yep.
Third, working on it. and fourth, not interested.
Okay. Poll is ready to go.
So let's hope that everybody will contribute. So how are we doing so far?
We got, oh. Somebody's put up an option, wants an option 5. It's complicated.
Oh, yeah, we can add that. Yes, please add that. Yeah, why don't you add that? Yeah, yeah. Or you can use not interested because it's complicated. I know.
Yeah, I think we'll go with that. I'll have to start it again otherwise.
No,
Somebody's put up
let's see. You have to be honest.
You've had a few interesting chats. Someone's in love with medicine, and someone else is not got enough time.
No, this is not what I want. I don't want you to be in love with medicine.
Okay, we've got quite a few responses now.
Okay, let's stop then. What's the ratio? Because I have the ratio from previous cohort of students. What's the ratio?
Somebody's in love with a fictional character. Okay, I'm going to stop the poll now, guys.
Yes. Thank you for all who have responded.
Oh, I've stopped sharing. I got what happened then? Sorry, guys. What did I do then? I've made a mess of it, Yassine.
Yes.
The main one was no. I'm afraid it was the biggest one, and it was pretty evenly spread across it actually.
Excellent. So for those who did answer no, then today you will know how to actually find a suitable partner. I think this is very important. So if you listen carefully, especially for the gentlemen in the room, then you will understand what it takes you to actually gain the heart of your beloved one. Okay, so This is the learning objectives. So we're going to talk about this antigen presenting cell, the MHC molecule, the beautiful job they do in presenting the microbe in such a way that your cells of the adaptive immunity can actually respond, not only respond, but also define the best response against the microbe. And it's very important for me to emphasize the fact that we are exposed to a variety of different microbes, and therefore the immune system needs to adapt and need to be able to develop the right immune response against different microbes. So as you know, and I'm sure you know, cancer is still a challenging burden. It's probably one of the leading causes of death. Probably 2/3 or more than half of patients who are diagnosed with cancer will die, unfortunately. And this was something obvious until recently. And I will tell you why, because this will change. You know, patient being diagnosed with cancer and dying will probably change in a coming future. And because of two major advances that we learn from our understanding of the adaptive immunity. First is going to be, you're going to hear a lot about CAR T cells. I want you to read about that, what they are. They are engineered T cells to fight against the cancer cells. And more importantly, we have now a new therapeutic tools that hopefully, and I've said that in my first lecture, you will be able to prescribe to your patient, which are called monoclonal antibody. And these are two examples of monoclonal antibody. You know they are monoclonal antibody because they finish by A-B. So you have nivolumab and ipilimumab. These are monoclonal antibody, okay? And I will tell you how it relates to our story. So let's meet Vicky, and hopefully, I hope for her, she's still alive. So she was diagnosed with melanoma, and you know melanoma is the worst kind of cancer, the most aggressive, resistant to treatment. And she was caught early. It was a year back, and therefore she thought everything was fine. She was going to live happy because the cancer was being caught early. Unfortunately, years later, she came to see the doctor because she has some lump in her breast. And after examination and all the investigation, she found out that she has late-stage melanoma, meaning that the cancer has spread in different parts of the body, including the lung. And I want you to see whether you can see here, this is a nodule, cancer nodule in the lung. So this is before, you can see here. So it was in the lung, so it had spread. And basically, when you are at the stage, the only thing I can say to the patient is you have to be frank, open, and say you have basically weeks to live. It was good and very fortunate for her that she was enrolled in this clinical trial. And this clinical trials is where you test different drugs, and these were drugs that had been used in different types of cancer. But at that time, they were brand new approach to treat different cancer. And the beauty about this drug is these monoclonal antibodies, they were specific against protein that you could find only on the cancer cell, the melanoma cancer cells. And this protein on cancer cells, what they were actually doing is they were sending signal to our main cells that normally kill cancer cells, which are T cells, to inactivate T cells. So the rationale was, if we give this two protein that will bind to the negative signal on cancer cells that inactivate our T cells, we can restore the function of T cells and therefore get rid of the cancer. And indeed, this spectacular achievement just to show you. So the biggest achievement we had in immunology that had changed the way we manage patients is immunization and modified or engineered effector cells from our adaptive immunity, which means T cells and monoclonal antibody. And you can see here, 12 weeks after treatment, this is here, you can see this is a typical CT scan. This is after treatment. It is the first time we saw that it was possible to treat late stage or advanced stage of melanoma with this therapy. And the message is if you can restore and understand why our immune cells are not functioning or killing the cancer, if we need to understand that. If we find out the mechanism, then we can block this mechanism, and you can see the mighty power of the T cells here. You can see that if the T cells are giving the possibility to kill the cancer cell, then they will do it. So the whole lecture of today is to tell you how these T cells get activated, and more importantly, go and look for these cancer cells and kill them. Okay, so let's go back. And if you take my T cells, put it in the petri dish, and this is naive T cells. Naive T cells is a cell that has never encountered an antigen. Okay, it's a brand new cells that come up. The thymus ready to be activated and ready to go and look for the microbe. So if you just take an naive T cells and take any microbe you want, put it together, you're not going to get any activation of T cells. If you change the type of microbe, you put certain bacteria, or you change it to viruses, you change it to fungi like we saw today, or you put cancer cells, the naive T cells with its receptor would not get activated. So you may say, oh, it's probably the number of microbe that will probably change the activation of T cells. If you do that, you're still not going to get any activation. Some people will say, oh, maybe it's the number of T cells that we need. We need more T cells to get T cell activated. In this particular, you still not get activation of T cells. The only way, and this is very important for you to remember, the only way you're going to have naive T cells to be activated is if you have this, the queen of the immune system, I call it, is the antigen presenting cells. Why? Because this antigen presenting, what they will do, and they have a specific job, is to capture the microbe, process it, meaning cleave it in a certain, in small peptide, and present it to the naive T cells for the T cells to be activated. Without these cellular bridges, you're never going to get naive T cells to be activated. And antigen presenting cells know exactly how to do that. And I'm going to, this whole lecture today is about telling you how these magnificent cells do that brilliantly. So this is, as you've seen before, you have innate barrier have been breached, and this is the major cause of infection, as you know. And this could be a cut, it could be injection drug users, it could be surgery, it could be anything. And you can have different type of microbe that can get in. The exogenous one that you do not find as normal flora, and the endogenous one. And the endogenous one I do, and you've seen example, give you some very invasive condition, life-threatening conditions. So what happened? They get into the tissue, and the first cells in the tissue go back are macrophages. What they will do, they will start the innate response, remember, to keep the infection localized and not become systemic. But at the same time, this is what is happening, is you're going to get an antigen presenting cells. They're going to sense there's the microbe, and we will tell how they do that. And they will then, this is a nice antigen presenting cells. Let's move that on the side. And you have a nice antigen presenting cells here in the process of communicating information to these naive T cells. And what this antigen presenting cells is telling the T cells is, first, there's an invader inside the host, as you can see here. This is how it looked like. And more importantly, third, this is the type of response I want you to do to kill it. You see, in a simple contact like that, you can actually orchestrate the T cell response. And because of this, you can generate the best cell response. If it's a virus, you're going to have the best cell response against a virus. If it's a bacteria, which is an extracellular microbe, I'm going to define that, you're going to have a different type of response. And this is because thanks to the antigen presenting cells. So, so how is this antigen presenting doing it? How is antigen presenting cell communicating all this information, without which T cells are clueless? They can't do anything. So first of all, I will show you they can sense the microbe. So they have an array of receptors that allow them to differentiate between host cells and non-host cells, which is microbe. So we're talking about they have a way to capture the microbe, which is basically to take it inside the cells, to chop it in small pieces, so that then, which I call processing, we can then present to the T cells, so that T cells can be activated. Therefore, you can see that T cells can only be activated by pieces of the microbe. which are called peptide. So these are the different antigen-presenting cells. The first two, which are very important. So in any tissue,